Hey guys, I'm Dr. Nicola Gaither at the Animal Hospital of Statesville, and this is Jules, who is here for her 12-week-old puppy visit. And we're going to talk to you today about a puppy visit and an exam and what all we look for with puppies. So when puppies come in for their wellness visit, we like to talk to the owners about what's going on at home. We like to get a thorough history of how they have been doing. Are they eating well? Are there any concerns? And then once we find that out, we want to do our thorough physical exam. So our physical exam on puppies, we want to examine them all the way from the tip of their nose to the tip of their tail. And Jules has a very short little tail here. Things that we look for with our puppies: we want to look for any problems that possibly they could have been born with, or things that could have happened to them as far as any problems. We want to make sure that they're completely healthy. So on the physical exam, I like to start at the face. A lot of us do our exams kind of routine the same way every time so that we don't miss things. So first of all, I just want to look at everything that's going on. I want to make sure that her eyes are nice and bright, that she's looking at me. There's nothing off or asymmetrical about her face. I want to look at her bite, her teeth. So I lift the lip, and we want to look to make sure that her teeth are lining up well, that her baby teeth look healthy. She hasn't injured her teeth. Make sure she doesn't have any broken teeth. Sometimes they like that better than others as far as being messed with in their mouth. We oftentimes, for our puppy visits, will use a little bribery, a little food to occupy them while we're doing our exam. I'm not going to give Jules any today because her tummy's been a little upset, but that does help facilitate our exam, that they don't even know that we're doing the exam while they're just eating a treat and they think it's a lot of fun. After I've looked at her mouth and make sure there's no drainage from her nose or any problems, we look at the eyes. We want to make sure her lids, in particular certain breeds may have lids that roll in or out inappropriately. One of that, what they roll in, is called entropion. So we want to make sure their lids are normal. We want to look at their pupils. We want to make sure that they are visual, that their pupils are symmetric in size. We also might have an assistant that helps us to hold our wiggly puppy sometimes, but we would use a light source, and we want to look closely into their eyes to make sure that there's no problems there in the eyes. We also want to check their ears. We have an attachment that we change out, and we look down in the ears. Some puppies can have problems with their ears. They can have discharge, or they can even have ear mites. And so we just want to look down in there. We look at the outer part of the ear to make sure it's not red or inflamed. And then we look down in the ear canal. The ear canal is a lot longer. Their ear canal is a lot longer than ours, so we want to make sure there's nothing kind of deep down in those ears. While I'm petting a puppy, oftentimes I'm doing the exam even if it looks like I'm just petting them. We're feeling lymph nodes that live kind of up under the jawline, up here at the prescapular area. I'm looking at how the pet is standing. Do the joints look normal? Are they curved? Are there any problems there? We're examining even all the way down their legs. We want to make sure their toes, that they have all their toes. Everything's where it should be. We look at their little dew claws. Some pets have dew claws that are removed at a young age, and I believe Jules's has been removed. Then we get back to the body. She also has a little kind of floating rib on this side that's poking out that a lot of owners will ask me about and think that that's something abnormal, but that's just a little cartilage there that kind of pokes out, and it's not a problem. You may be able to see it on her, sort of poking out that area there. We want to feel their belly. We want to make sure that there's no problems inside the belly there. We can oftentimes feel the bladder. We can feel the kidneys and stomach and small intestines just by feeling into their abdomen. I also want to feel along the umbilicus. So puppies can be born with a little umbilical hernia. And so we would feel right along the midline in the center. So where our belly button is, we want to make sure they don't have an umbilical hernia. Then a very important organ is their heart. We want to listen to their heart to make sure that it sounds normal in rhythm and no signs of a heart murmur. So we listen to the chest on both the left and the right side. Oftentimes we're taking a heart rate, measuring a heart rate and respiration rate. We listen to their lungs. Puppies in particular can be born with some genetic heart problems, so that's why we want to listen to their heart and make sure that their heart sounds good. Then we go to the back end. So the back end, we want to look at everything here. Of course, Jules is a girl, so we just want to look at all her parts to make sure that everything looks normal. If she was a boy, we would want to feel both testicles, that they are in the position in the scrotum where they should be. That is another problem with puppies, that they may be what's called cryptorchid if they don't have testicles in the right position. Jules has been a great little patient for our puppy exam. If you have any questions, please feel free to contact us at the Animal Hospital of Statesville. We'll be happy to answer any puppy questions that you may have. There are a few other things that we talk to our clients about as far as educating on wellness and vaccines and checking their stool for any problems, as well as starting heartworm prevention when they're puppies. But that is the basics of our physical exam. Thank you.